vaccine requirement of, say, about for purposes of easier mathematical computation. We're talking about 150 million doses, no? So if you divide that, you'll get probably about 550 pesos per person. That's the cost to include the peripherals and the ancillary services, which you have correctly pointed out: distribution, logistics, cold chain requirement, etc.
That's the answer of Mr. Concepcion, Secretary Duque. Perhaps later on, our colleagues will be asking you what about the other brands, you know. So, right, let's proceed already with
Can I
those who
ask?
were not able to ask during the last hearing.
I just want to ask a
Let's,
clarificatory question. One short question,
Senator,
Mr.
Senator Villar,
Yeah.
yes, go ahead.
As I understand yung
Ano, na pag-aari ng private corporation na 50,000, sino magdi-distribute?
This will follow the DOH guideline on the prioritization, considering that private sector should follow also the principle of
why will they
equitable
follow?
access.
They bought it. They donated one half. So they have the right
That's
to
her point.
determine what they
Yes,
will
the
do with
point.
the one
Sila
half.
may-ari, sila
Sila
bumili.
may-ari,
Ang
sila bumili,
sinasabi ni Senator
nag-donate na
Villar,
sila eh.
Sir,
Nag-donate na sila
hindi
eh.
niyang gamitin sa gusto niya.
the
Oo.
private sector, the AstraZeneca has a principle of equitable access and no privileged
But you
access.
paid for it. Why will you pay for it?
Basically, the principle that we have followed with the business sector and the LGU is they will follow the guidelines of the distribution and prioritization of DOH.
So yung private corporation nila dyan ay yung guidelines pa rin ninyo
Yes, sir.
na sinasabi ang uunahin ay health workers, number 1.
Yes, sir.
Number 2, indigent seniors.
Yes, sir.
Yung pa rin, yung sequence na sinasabi nyo,
Yes,
ganun
sir.
pa rin ang gagawin ng private corporation.
Yes, sir.
Eh kung walang health workers yung private corporation, bababa na ron.
Yes, sir.
Wala naman silang indigent senior citizens. And et cetera, ganon.
So they will follow the sequence of frontliners and essential workers. Low,
All right.
low
Ah.
earning, low earning.
Employees kasi pag hindi nila binigyan yung employees nila, hindi mapoprotect yon, hindi magbubukas ang economy.
Mr. President, a similar question is with the permission of the Senate President. Very quickly,
Yeah.
does this mean therefore that the purchases of the local governments will also first be forwarded to the DOH before it is eventually distributed?
Sir, there's a technical inspection first of the, of the vials. There is a process. So meaning we have to take care of the warehousing first to keep it safe.
I convince our
Yes.
local government to buy with the intention that what they will buy will go to our local, to Las Piñas. Like Las Piñas bought 300,000 doses, so it will go to Las Piñas.
Yeah.
Why will they pay if it's not going to Las Piñas? What local government will pay if it will not go to Las Piñas or to Makati or to Quezon City? This is crazy. I hope you will clarify that.
I think
Can I-
Secretary Galvez, go ahead, you have the floor.
Sir, to clarify things, this is the procedure. We have to follow the procedures considering that this is a sensitive sensitive items. So once that this will be the time emotion. I will discuss, Your Honor, the time emotion of the arrival. Once that it arrived in the airport, it is the DOH that will accept it for the purpose of administration and logistical recording. Items. Because it is in the law that we have to check whether the vaccine that has been transferred to us is really the vaccine that we have procured. Next, if the LGU is the one who procured it, it will be fully deployed to the concerned LGU. So yung doses na binili nila para sa kanilang mga constituent will be given to them, and even the government will add it up, the procurement of the government, so that we can have some sort of 70% herd immunity for the certain geographical area.
nyo.
Yes, sir.
Oh,
Prioritization, sir.
hindi ba?
Yes, sir.
Oh.
Ano?
May we ask Senator, Mr. Concepcion, Joey Concepcion of
Yes.
One Negosyo, is that
Yes,
the
so-
procedure that you're going to follow?
The procedure of AstraZeneca, because of technically speaking, we are donating 100% of the whole to the government. So they will take possession. But it is understood in the tripartite agreement of that 100%, 50% will be given to our employees, following the priority sector, again, the frontliners. Again, it was said to us by AstraZeneca under the privileged access that our families cannot be part of it. I'd like to make that clear. And that was made clear during all the meetings with the private sector companies. Yung mga may-ari hindi pwede. Yung mga executives namin hindi pwede. Yung pwede lang dito yung mga frontliners, merchandisers, security guards, lahat yan. So that is in the agreement.
Know
And
that.
and that was explained. Now, and it's very clear also that on the execution part, hindi kami mag-execute, yung government ang mag-execute nito, yung DOH. Anybody as of this point in time yet. Si Sec Charlie is in charge of that, those other vaccines.
Secretary Galvez, what about yung sa LGUs? Puro AstraZeneca rin ang kinukuha nila?
Yes, yes, sir. For now, sir, AstraZeneca pa lang ang nag-o-offer ng definitive.
That's also because of the non-profit point or issue.
Sir, majority po ng ating nine-negotiate is no profit, no at cost lang po. So kung makikita po natin, yung pitong manufacturer, they follow the same rule because of the COVAX Gavi WHO directive that we should put premium on equitable access to the poor.
Question, Mr. Senator. Mr. Senator.
Kabila, so we can proceed to the others. Go ahead.
Yeah. Pag halimbawa, ang kumpanya, bumili siya ng doses at hindi siya will not be allowed to use it to the employees of the company, ba't pa siya bibili? Ba't siya pa bibili? So, dapat bigyan na ng right yung mga companies to buy directly. Kasi pag ganito, pakikialam pa rin ng DOH kung sino bibigyan ng kumpanya. Mo bigyan. Para nang sa ganon, matapos na yung problema na kayo ng kumpanya. Kaya sila nagbabayad. Why will they buy
Alright.
if they cannot give it to their employees?
All right.
Siyempre, hindi mo naman
Senator
pwede
Villar,
sabihin na tindera mo lang ang bibigyan mo. Hindi mo bibigyan yung mga manager mo. Without the managers, who will manage the tindera? And who will manage the
Alright.
accounting? Who will manage the other work of the company? This is impractical.
I see the point of Senator Villar, but allow me to
AstraZeneca.
explain part of what I'm getting from you guys, you know, the government side. Let us take the example of the Senate. All right, we will procure, let's say, 2,000 doses. All right, 2,000 doses. 1,000 is donated to the government, 1,000 to, or baka walang i-donate dahil government kami. O, palagay mo na, 2,000. Ang gusto ninyo, sundin namin yung protocol. Like for example, in the case of Las Piñas, Las Piñas will have bought 120,000. 60,000 sa gobyerno, 60,000 sila magsasabi. Di ba? Hawak nila yun. Di ba? Ngayon, yung 60,000 na gusto namin ng
we have to prioritize for those who are very vulnerable to preserve the healthcare institution. Nakita po natin priority po ang health workers because they are the most vulnerable amongst the whole sector and they're the one who are fighting that will heal us in this pandemic. Secondly, we have to preserve, sir, yung institution that will implement the frontliners nyo na you will recover. You will recover we will recover the institution by having yung essential workers. And what are the essential workers? Yung tinatawag natin po sa nasa water, light, transportation, and also those life-saving essential workers and frontliners. That's why the imposition of the priority is not only imposed by us, but by factor who follows the imposition of the WHO.
all right, okay. I think some of those points are clear. Let's proceed with the
Senator, I will just answer. When a
Yes.
company buys, it buys for everybody. So may priority, but it has a supply for everybody. Kasi pag in a company, you cannot just choose which you want to vaccinate. Magagalit yung mga empleyado mo. Dapat pag bumili ka, para sa lahat ng empleyado. So hindi mo pwedeng
yes,
sabihin,
yes.
mauuna lang siguro yung
It's-
naka-frontline, but everybody will be vaccinated and you should be allowed to do that kasi ang binili mo, enough for everybody. When you're running
Yes,
a
according to them,
company,
you're allowed to do that.
yeah.
Senator Villar,
Yes.
you're allowed to do that. Sinasabi lang na unahin lang yung mga
That's okay. But when we bought,
kung
it's
wala
for
kang health worker,
everybody.
diretso mo na agad sa mga
Diretso
empleyado
na.
mo.
I just
That's the
want to
point.
clarify that kasi sinasabi nila
Yes.
na hindi daw pwede yun. Hindi
Alright.
pwede yun. I mean, if you're running a
Okay.
company, you buy for everybody or else your employees will get angry. And they
Clear enough. Now let's go to those who were not able to ask last. Senator Bong Revilla, you're recognized. You have 10 minutes.
Thank you, Mr. President. Okay, my questions for Secretary Galvez. The study made by Octa Research, composed of professors from the University of the Philippines,
ating mga bakuna at sinisiguro po naman ng administrasyon ni Pangulong Duterte na talaga pong dadaan ito sa proseso at sisiguraduhin ang kaligtasan at ang epektibo tugon sa inyo pong katanungan, hindi po ito mandatory vaccination program. Voluntary po ito at magkakaroon lang po yung mga magpapaturok. Meron po tayong kasangkapan o instrumento. Ito po yung tinatawag natin na consent form. Yung mga risk and benefit ng bakuna.
Yes, Mr. Secretary, meron ba kayong ginawang kahalintulad na survey sa particular na sektor tulad ng medical professionals, frontliners, elderly, uniformed personnel kung gusto o ayaw nilang magpabakuna? Meron po ba tayong, kumbaga ano po bang nasabing, kung may resulta na, ano po bang lumabas dito sa survey nito? How do this kind of surveys translate to the national level of people's acceptance of the vaccine? And did we factor in the results of the surveys in the procurement plan of COVID-19 vaccines?
Na lumalabas, may galing po sa Okta, may galing po sa Pulse Asia, may galing po sa Social Weather Station, at mga iba pa pong mga survey outfits. Kami nagpapasalamat sa kanila kasi dito po natutukoy natin kung ano-ano po ba ang naging dahilan kung bakit may agam-agam o pag-aalinlangan ang mga ilan na sektor o grupo sa ating pong lipunan. At we will do a targeted magpapakita wala at magpapabakuna. Salamat po.
Kasama po sa posibleng miyembro sa health education at bilang documenter, recorder, and vital signs taking. Are we referring to all teachers o public school teachers lamang po?
Initially, mga public school teachers lang po muna, pero kung kinakailangan dahil pagka dumami na po ang bakunang darating at hindi po sapat ang atin na yaman tao or human resource no na magko-complement doon po sa bakuna. Pero tama po kayo, meron tayong mga bawat vaccination team, anim na miyembro ng vaccination team. May dalawa, either a doktor o nurse o midwife para po sa screening and assessment. Isa pong allied professional or volunteer para sa health education. Diyan po papasok ang mga guro ng pampublikong mga paaralan. At meron po tayong for vaccine nurse, a midwife. Lahat po ito ay ititrain, magdi-develop implement our vaccination rollout plan. At meron din po tayong dalawa pa na either midwife, barangay health worker, or health staff, volunteers from partner agencies para po doon sa po. So, ayan po, meron po tayong total of 1,245 na atin pong mga healthcare workers na gagampanan po ang vaccination program. So, meron po tayong assessment sa kasalukuyan kung saan po nagkulang at pinag-aandaan
teachers, bilang ng mga teachers na kakailanganin, magiging partisipasyon ng mga teachers, haba o tagal ng panahon na magiging partisipasyon ng mga teachers natin.
Ang tanong niyo po ba, kung kailan sila mababakuna?
No. Ang tanong ko po ay kumbaga ano po ang magiging basya ng mga lugar kung saan kakailanganin ang tulong ng mga teachers bilang mga teachers na kumbaga ang bilang kung ilan mga teachers ang kakailanganin, haba o tagal ng panahon na magiging partisipasyon ng bawat guro.
Aalamin ko pa lang po, Your Honor, yung atin pong assessment. Kasi sa kasalukuyan, kinukumpleto pa po natin ang assessment kung saan po pwedeng ipasok ang tulong ng mga guro sa atin pong rollout and implementation.
Yes. For clarification, the DOH presentation used term volunteers, which means that this is not mandatory for teachers. Tama po ba?
Tama po kayo. At madagdag ko lang, kagaya po ng nasabi ko kanina, pinakamaganda o angkop na papel kanila pong gagampanan ay sa health education para magabayan ang mga babakunahan, kung ano po ang dapat nilang bantayan, ano po ang mga posibleng side effects at kung paano po ito i-report sa mga tamang kinakaukulan na otoridad.
Okay, sinasabi ng ating mga opisyal na inaasahan sa February 20 sa dating na unang batch.
Yes, sir. Your Honor, Secretary Galvez. Yes, sir. Nagagawa na po tayo ng tawag nating time and motion. Titingnan po natin yung preparation po ng ating mga LGUs at the same time yung mga vaccine centers. And doon po na meron na po tayong mga tinalaga ng mga vaccinators in different rollout areas. And tinitingnan po natin sa possibly look na makakulangin dahil because of the vaccine time. If we can magnify it on the second delivery for almost 1 million for one vaccine maker only, we can expand yung model. Ganun po meeting sa Philippine Nurses Association so that we can make some volunteers in terms of the administration at saka yung tinatawag na to increase the public uptake.
Yes, will the volunteers receive any allowance or any form of remuneration for their participation in the vaccination program? At saan po manggagaling ang pondo na ito?
Sa ngayon po, ano po natin is because of we are encouraging on volunteerism and bayanan spirit. Sa ngayon po, ang ano po natin is we have not allocated for the volunteers. Only maybe donations for food at saka po yung maybe subsidy po sa food and transportation. But we will, sir, we will look at the possibility that we can, if there is available fund, we can, augment the services and also the honorario. Sir, sa ano po natin, sa ating element ng lessons learned, nakikita po natin capacity po na 150,000.
150,000. Kumbaga kung ito'y gagawin ay tuloy-tuloy, wala po itong weekend breaks, no holidays. Magtatagal ang ating vaccination program, himigit kumulang sa 1 buwan, ay 3 linggo. Tama po ba?
Yes, sir. We are looking at the possibility that if the vaccines are available, we will have 24/7, 3 shifts, 24 hours po. So, ganun po ang gagawin natin. We might have that kind of situation so that we can ensure that the vaccine will be yung ano po natin, we have also some experiences also abroad. Nakita po natin ang Israel, ang record po nila is I believe 190. We are looking at the 50,000 that will be coming this February will be our rehearsal.
Okay. Mr. Secretary Galvez, can you again spread into the records ilan April, May? Let's take that 50,000 or 80,000 vaccines figure to better understand the vaccine rollout plan, no? Kung ano yung numero na nabanggit nyo kanina. Mag-walk through po tayo sa proseso, no? Una, meron na po ba tayong exact date of arrival nitong nasabing vaccines na kung ilan man ito?
Sa ngayon po, ang indicative date ng isang vaccine maker is February 20. Yung sa COVAX po is more or less in the middle of February. But the WHO and the Gavi have not fixed yet on the date. But indicatively, it will be in the middle of February. And then March, we might have more or less 1 million. And then April, we will have 2 million. And then the other vaccine makers cannot make a promise right now because the negotiation is still ongoing.
Now, pagdating sa Pilipinas ng vaccine, sinasabi niyo po ang DOH ang tatanggap at merong
Karoon po tayo ng sampling that the vaccine that we have ordered is the same vaccine that we will arrive. And also, we can also do inspection doon po to the site. We are planning to look at the possibility that we will go to the site so that we can see how our vaccines are being made and how this will be delivered on tranches, so that we will make sure that the timeline that we'll be having will be properly administered on time.
Okay, yung mga recipients ng vaccines, Mr. Secretary, informed na ba sila this early na sila yung unang babakunahan?
this coming January 30. That will be our deadline. That the master list for the recipient, the master list for vaccination, and the master list for the resources that we will be using will be on January 30 po.
Yung ibang supplies na kailangan, Mr. Secretary, like PPEs, gloves, syringes, alcohol, naka-ready na po ba ito? O may sapat na po ba tayong supplies ng mga ito?
Naka-ready po tayo, pero kailangan din pa po natin dagdagan at fina-finalize lang po natin yung mga figures para nang sa ganun po ay maging matagumpay po ang ating rollout ng pagbabakuna. So lahat po yan kasi ngayon po sa pagbabakunang ito, hindi po ito simpleng bakunahan dahil kinakailangan pa rin paigtingin or in the context of pandemic. So kinakailangan ho na maging secured at safe ang ating pong mga mamamayan at ang ating pong mga vaccination team members. Kaya yung kanilang mga face shield, face mask, yung sanitation area, lahat po ito ay meron po tayo. Augmentation na lang po ang gagawin with the LGUs. Salamat po.
Okay, Mr. President, yun na lang po muna. Then, just like to thank Secretary Galvez and Secretary Duque for answering my questions. At alam po natin na matinding pagsubok itong hinaharap natin. Kumbaga, konting tiis lang at makakaraos din tayo dito. Pati na rin sa ating mga kababayan. Yan, thank you, Mr. President.
Nancy Binay, Senator Binay, you have 10 minutes.
Thank you, Mr. President. Siguro just to pursue yung point ni Senator Bong Revilla. Secretary Duque, nasabi niyo ho na may mga available na tayong syringe.
Ma'am, kukunin ko lang ho sa staff ko kung ilan, hindi ko po memoryado yung Madam Senator.
Okay, thank you, Secretary. And then for yung augmentation ho, more or less, Secretary, ano yan, na-bid out na?
Ongoing pa po eh. So pati yung bidding yan ay kasama sa proseso ng procurement at tutulungan
But Secretary, for 50,000 doses, we have sufficient supply. Like for example, syringes, bulak, meron naman po.
yes, ma'am. Yes, ma'am. We have about 30 million syringes, ma'am. 27 auto discharge syringes and about 3 million. So ito po, ma'am, we can just submit it to you. Would you want me to read it out, Madam
No,
Senator?
Secretary, just for submission.
Yes, we will submit makin, ma'am.
Okay. Ano ho ba usap for the supply cold chain management?
Meron na po. In fact, out of the 18 companies that the DOH supply chain management team, andito po si Yusek apat po dito ang may kakayahan as a third-party logistics provider, kaya po nila yung iba-ibang temperature requirement. Kasi iba-ibang bakuna, iba-iba po ang temperature requirement. May iba po +2 to +8 degrees centigrade. Yung iba naman po -20 degrees centigrade. At may isa naman po dyan ay -70 degrees centigrade. So, apat ang kumpanya na naghahayag na sila po ay kaya po nilang ma-accommodate itong mga iba't ibang klaseng mga bakuna. So, meron po tayong apat na companies na nakausap.
But at the moment, Secretary, may padating na yung kinakausap. Wala pa tayong ina-awardan for the supply cold chain management.
Madam Sen, for our +2 to +8, yung pong RITM natin, andyan na po yung mga regional warehouses and cold storage facilities po natin. So naka-inventaryo na po tayo lahat, Madam Senator. So kung ano man yung kulang, bandang mga July, August na ho. Pero aagahan po natin, tama po kayo, na dapat ay we have to be 10 steps ahead.
I'll just add, book sure that the president that we can manage the supply chain, even the -80, -70, and -20 ultra cold facilities.
Pero Secretary Galvez, I saw sa news yung presidente ng cold chain groups, parang wala pa daw sa kanila nakikipag-usap from government. And I think invited ho ata natin sila ngayon. Can they confirm this?
Nandito po ang Sweden po at saka po ang Unilab.
Yeah. Madam
but
Senator,
the
meron po kami
group
listahan ng mga nakausap na po. 18 na nga po ito. We will just submit to you the list, Madam Senator.
Madam Chairperson, with the permission of Senator Binay, just very quickly.
Go ahead.
Yes, thank you, Mr. President. Thank you, Senator Binay. Can the inventory of all these cold chain equipment and itong mga ma-submit din sa atin so that we know exactly what the situation is. Yung inventory.
We will do.
Thank you.
Okay. I
Okay,
think
go ahead,
invited ho
please,
ata natin, Mr. President. I think si Mr. Dizon is part of the Association of Cold Chain. Tama po ba?
Yes, he's online. Would you like him to respond?
Yes, please, Mr. President.
Yes, good morning, Mr. Senate President. Good morning, Madam Senator, and all the other members of the committee. Maraming salamat po sa pagkakataon na makilahok dito sa hearing na ito. Gusto po lang naming i-manifest at this point na baka ilang ulit na po kaming nakipag-usap sa gobyerno para ilahad ang aming kakayahan, our capabilities and our willingness to participate in this vaccine distribution program if we are called upon. Ko-confirm ko lang po yung binanggit ni Senador Nancy na nasa dyaryo po ngayon na sinabi ko kahapon na hindi pa po nakikipag-usap sa amin ang gobyerno. Kaya po hindi rin namin masimulan ang paggawa ng pangplano ng action plans na aming maaring kailanganing ipatupad dahil hanggang ngayon po wala kaming naririnig na malinaw na direksyon. Ang masakit pa po nito, as of yesterday, we have received unofficial information that the participation in the vaccine distribution program will also be subject to guidelines, restrictions, and terms of reference that may be provided by regulatory agencies. Lalo po kami hindi makakakilos dahil hindi po namin alam po yung mga guidelines na yon. Nevertheless, ang amin pong posisyon sa ngayon, handa pa rin po kami namang tumulong because we have been operating this industry for so many years under the guidelines of the regulatory agencies that pertain to food supply chain na sa palagay po naman namin hindi naman napakalayo sa magiging guidelines for the handling of vaccines. Kailangan lamang po namin malaman kung kami kasali o hindi.
Maraming salamat po. Yung kailangan po natin dito yung pharma grade cold chain. At gusto ko lang pong basahin ang mga kumpanyang amin na pong mga nakausap, Your Honor, Mr. Chairman. Yung pong Orca, yung pong Royal Cargo, Maersk, Jetcore, Diamond, Pharmaserve, Vantastic Incorporated, LBC, Cool Air, Country Force, Fast Logistics, and Zwellig. So hindi po kami, tama po kayo, ang kinakausap po namin diretso na dun sa mga providers. Pero ready naman po kami makipag-ugnayan dun sa inyong asosasyon. Kung meron pa po kayong mga pwedeng i-recommenda, we will promptly look into this, Your Honor, Mr. Chairman.
At siguro, Secretary Duque, di ba mas maganda kung mas marami yung magagamit natin ng cold chain? Kasi ang naririnig ko, based dun sa mga interview sa inyo, kumbaga nakakahon tayo sa isang klase ng bakuna kasi ang limitation ay yung storage, yung cold storage. But kung mas marami makaka-provide, ibig sabihin mas marami.
Madam Senator, kasi ang dalawin po natin there are two cold storage. Yung agricultural cold storage saka yung pharma. Ang kinakausap po natin yung pharma grade. Kasi po kailangan po ng training po yan at saka extensive experience. Kasi balita po natin talagang very sensitive po yung pag-handle po ng cold chain. So yung kinakausap po namin, ma'am, connect sa mga cold chain pharma operator. And many LGU already are can accommodate yung -70 at saka -20. So yun po ang mga preparation po natin na yung ang ginagawa po natin ngayon by areas, and even we are connecting with other big companies that can accommodate millions of dosage of so yun po para wala pong discrimination sa ano po natin sa ating pagbabakbak po.
Yes, kaya nga Secretary Galvez, napakahalaga na kinakausap na natin itong grupo ng cold chain groups, di ba? Kasi what if meron sa kanila na willing naman to shift to pharma grade? 'Di ba? Kaya kailangan ngayon pa lang nag-uusap na dahil base dun sa statement nyo during the Monday hearing, kumbaga